Hey there, it's Dr. Justin Marcagiani. Evan Brand, what's going on, man? How are things?
Happy Monday. Life is good. The sun's gone though. That's sad. This time of the year, it's just gonna start that gray sky. So I'm kind of jealous. I'm sure it's sunny in Texas right now.
Well, it's a little cloudy out here today, but I was actually in Lake Austin yesterday water skiing. I got a new suit. It's about a 3-4 millimeter kind of thickness suit. So it's great. I go in the water, doing pretty good. I got some little booties too that are neoprene and some gloves. The worst thing was the week before, I didn't have the gloves, is you don't, because when you're squeezing really hard, right, you kind of squeeze a lot of that blood out, right? You kind of like, white knuckled, so to speak. So you don't have a lot of blood. So your hands get really cold with the air. So those new gloves made a huge difference.
Oh, that's awesome.
Yeah. How are things going with you?
Things are good. The baby's running around and keeping me busy. She basically stole half of my lunch. She took all my carrots and almost all of my peas. So that's a lot of fun. Tweaking her diet. We just actually ran a GI map on her. So when we get the stool test back, we'll have to uh, chat about what's on there. Actually, no, I take that back. We got the results. She had Klebsiella on there. So that's pretty interesting.
Awesome, dude. I got my dog Butter here on the YouTube if you guys want to see her. Butter. We love good healthy fats. That's why we named her Butter. But yeah, so we're in the same place. Aiden's doing really good, breastfeeding like crazy, and he's starting to sleep a little bit more. So we're really excited about that. Really happy your daughter's going good too.
What do you think about the Klebsiella with her? I mean, we're using some herbs already. It's like at her age, it makes you wonder, did she pick up Klebsiella from somewhere? Did she have it? Was that passed through the placenta? I mean, it makes you wonder, her being that young.
Yeah, I mean, I would say off the bat, probably something from your wife or from you guys, and I would utilize some probiotics and maybe one oil of oregano capsule a day or something like that would maybe be decent to help keep it really
We're
low dose, but use more probiotics than anything else.
we're doing that tincture I was telling you about that's got the I think it's
Yeah,
got the
good one. That's a great one. I like that.
look it up. But anyhow, so I'm sure we could do a whole podcast on that. But I figured today you and I should chat about creating a protocol. If you're trying to create a functional medicine toolbox for gut health, what would that look like? And that could involve things that could help with fungus, yeast, bacteria, and parasites. We've hit on parasites and the influence of thyroid health and adrenal health, and we've hit on the link between parasites and leaky gut and autoimmunity. So now I feel like it'd be good for us to reveal some of the tools of the trade, which you've already mentioned one, which is the oregano. So maybe let's go into the order of operations first. Let's talk about what comes first, like in this whole functional medicine approach, because some people, they think probiotics should just be used anytime and prebiotics, you could just throw them in. But really there's a science and there's an order to herbs. Probiotics may not be the first thing that you should look at for an adult.
Yeah, no, I 100% agree with that. So first things first is looking at the foods. If we have certain foods that are more offending or more inflammatory, that's going to potentially create the breeding ground in which bacteria can overgrow. And there's lots of different bacteria that can grow. So, I mean, we have more of our pathogenic type, our Klebsiella, our Proteus, our Citrobacter, our Morganella. These are our dysbiotic bacteria, not so good. They produce toxins in our body. They can eat up B vitamins. They can prevent our good bacteria from producing nutrition. So, of course, we want to make sure those things are under control. We would look at the foods first, keep the inflammatory foods down. I think potentially in your daughter's situation, there may have been some foods that may have been slipping in, some like kind of pseudo paleo foods potentially. What
Yeah,
food do you think we're slipping in for her?
well, so we were doing the rice flour. We
Rice
had
flour? Yep.
rice flour, and also there was some tapioca starch and some of these like dried veggie snacks. They had tapioca in there. So I'm thinking, because remember I showed you that she had a small rash under her eye?
Doing that improving.
It's gone.
And what food changes did you make?
The rice flour, we took it
There
out.
you go. I think there's a big gluten sensitivity component there. So I think
Yeah.
once you get that better, the gut bacteria will get better. So now once that's better, looking at digestive support. So if they're kiddos, I mean, what can you do? So typically we'll do we'll do some enzyme wafers that are really easy to chew and taste pretty good for little kiddos that can eat.
Is there
If
any good brands? Because I looked at some and it looked like a lot of them had fructose in there added.
Yeah, I mean, I like the Vitalzymes chewables. That's a
Okay.
pretty good one. If they can swallow a pill, then we maybe have them do an HCl enzyme combo. If they can get a pill down, if they can't, I do a wafer.
Ah, okay.
I would do that, and just really making sure they chew their food up really well. and then just cutting out the inflammatory foods. So that'd be my first two steps right there. And then I would even maybe do a smoothie for one meal a day and really just add some extra aminos, add some extra nutrients in there, so it kind of gives her digestive system a break for at least one meal.
That's a genius idea. Did you know that the Vitalzyme chewable has the DPP-4 in there? So that would be great if there is a cross-contamination issue going on.
Yeah, and that would be helpful. And the chewable, those taste pretty decent too. I've had a couple of kids, I've had a couple dozen at least the last few years do well with those. So I like those a lot. And then the next step is, the killing phase. We kind of talked about, the foods. We talked about enzyme support. Maybe we added some gut healing nutrients. Maybe we added some collagen peptides. Maybe we added some L-glutamine to keep it really simple for the kiddos. Maybe we just put that in our morning shake. A couple of blueberries or berries, maybe a nice scoop of collagen or pea protein to keep it more hypoallergenic, maybe some coconut milk or MCT for some extra good fats. Maybe we add some extra L-glutamine, or like in my line, we use like a GI Restore, some extra healing, soothing, mucilaginous herbs, right? Aloe, slippery elm, DGL, licorice, all very healthy and soothing. And then maybe we start the killing in a month or two later. We could start even with just like a teaspoon of silver, right? Twice a day for your daughter who's younger, right? Something very, very small. Maybe do one oil of oregano pearl once a day.
The silver is great. Talk
Yeah.
more about the silver. I mean, there's antimicrobial benefits. I believe there's anti-parasitic benefits, possibly.
Yeah, I mean, silver is proven to help with biofilms. They're actually, my mom's still a surgical nurse. She's been a surgical nurse for like 45 years. And she is even the last couple of years, they are actually adding in a silver wrap. So when they do like a total hip or a total knee, they're actually wrapping the whole joint with this like aluminum foil like thing, but it's silver. And they wrap the joint before they close it in that to prevent basically antibiotic resistant bacteria from coming in.
And that stays in?
No, it dissolves.
Oh, dissolves.
Yeah, it dissolves. It's kind of like a cellophane thing that kind of dissolves. They do it. There's one called Ceprafilm. They put over like, if they do a surgery to prevent scar tissue. So it's similar to that. It's kind of like a cellophane thin kind of thing they wrap over. And I'm not sure if it's up against the joint directly or if it's around the fascia and the skin. I'm not sure about that, but it's definitely enclosed around that joint for sure to help with the biofilms and the resistant bacteria. Conventional medicines getting on board, and they have to because they have a lot of problems with antibiotic resistant bacteria. So they kind of have to.
Yeah, the C. diff, the MRSA. I've even heard of anti-fungal resistant, like these species of Candida, the diflucan, and these other prescriptions aren't working for even the yeast anymore. The yeast are evolving and getting too smart. Luckily, in our toolbox, we're not using pharmaceuticals. We're using herbs. And in this case, if we're talking about Candida, you mentioned the silver. We can use silver against Candida too. The oregano can be against Candida. The garlic can be another good choice.
Yep, exactly. And there's some liquid garlic options that we could always give her too as well. And then we could do some of the oil of oregano. I like them because they're smaller in pearls. So like in my GI Clear 5 line, we have that where we use the emulsified 75% carbachol extract. So it's very potent and it's a pretty small pearl. So typically that's easier to get down, and you can do that with the kiddo. You can do the silver, like I mentioned, and then we could always do some liquid garlic. So those would be like kind of my options for kids that really have a hard time with pills off the bat.
Let's chat about some statistics. I've seen kids as young as 1, 2, 3, 4 years old, and they have infections, parasites, bacterial problems, a lot of candida problems because the kids were unfortunately exposed to antibiotics early on, and now they've got a massive systemic yeast overgrowth.
Yeah. So of course, anytime you have to use antibiotics, because there may be sometimes you're scared as a mom or dad, right? You're like, oh my gosh, this is getting out of control. Number one, like have some things in your medicine cabinet, like the silver. You could do even some ginger capsules is good, or some higher dose ginger tea if your kid can get that down. Those are going to be great. Of course, keeping the sugar out. But if we had to come at it with some probiotics during the killing, we could always add in some probiotics, some powder probiotics, and some Saccharomyces boulardii, and we could put it in their drink, right? We could get them to have a nice little smoothie. We put that in there, or we could just mix it in maybe their kombucha or something, or we just come up with some kind of a drink they like and put it in there. That could be some really good options during the killing. And of course, we would do it after for at least 1 or 2 months.
So what do you think about probiotics? I mean, some of the training I've seen and some of the protocols recommend probiotics during. a killing phase, and then some protocols don't recommend probiotics. I
It
mean, it's like,
depends. It depends. There is some research showing that probiotics during antibiotic therapy can actually be beneficial. And again, most conventional antibiotic therapies don't go longer than 2 weeks. So I'm not that worried about it because we're going to be given probiotics afterwards for at least 2 months. So I'm not worried about if we want to go do it for 2 weeks, do the probiotics while we do the antibiotics. I'm okay with it, especially if you have digestive issues. And let's say the probiotics really help and they're soothing. Maybe they help keep you regular. Maybe you have a history of a lot of rebound yeast overgrowth because of post antibiotic therapy in the past, then I would. If you don't, then I would just wait till afterwards. I don't think you can go wrong if you do. Some people, they have histories of just antibiotics, or I should say probiotics, causing a lot of bloating and gas. And if that's the case, then I'd probably wait.
yeah.
We may use some different strains. We may use some oil or spore-like strains, or just doing it after the antibiotics. A lot of that flora is going to be knocked down. So maybe the probiotics are more tolerable after that as well.
And the same thing would apply for just straight herbs. If you were just doing straight herbal protocol, sometimes you're going to use probiotics during the killing, sometimes you're not, or are you always using?
I only use probiotics during the killing if we're on a repeat protocol, like if we retested and we have new infections or other infections, just because I want to prevent any rebound overgrowth from happening.
Yeah.
Just kind of where you knock a lot of the flora down, you even knock the good stuff back. But we all know if you do weeding in the garden, you never have to go back and purposefully plant weeds, right? Weeds automatically grow.
Yeah.
So kind of like that, we're just kind of throwing down extra seeds during the process to take up the space that maybe those weeds would take. So it's kind of like a preventative thing, as well as it can have benefits with inflammation and it can have benefits with regularity and motility as well.
That's good advice. And also, too, you and I see the beta glucuronidase enzyme on the stool test that we run. And if that enzyme's elevated, that could mean you're recirculating your toxins and hormones and drugs and stuff like that. And one good way that we can get beta glucuronidase back down into normal range is probiotics. So I love you bring up.
So we can also use phages too. Phages have some really good beneficial effects at knocking down that bacteria. And then, depending on how regular you are, we could even slide in some activated charcoal too. Some activated charcoal or some like modified citrus pectin, kind of act like a little sponge and soak up a lot of the crap that may be sitting around in your gut from all that bacteria.
When would you make the call on that? Would that be like if you have a ton of bacterial infections plus parasites, like you're trying to treat 5 or 6 things at once? Like what if it was just H. pylori? Are you going to hit the charcoal or not?
Depends on the person's resilience. If they have a lot of fatigue and they have a history of being more sensitive, or they have a history of like lots of antibiotics and like they tell me, yeah, like in the past, antibiotics have really wiped me out, or I'm just really tired and fatigued, then maybe I would add it in preventatively. If they're if energy's pretty decent, then I would say, let's wait and see.
Yep.
Wait and see. But it's something that's always there, kind of on deck, so to speak. So if we need to go to it, we can go to it. Of course, one of the first things we can do is ginger tea, because ginger really helps the lymphatic systems. It's very anti-inflammatory. It keeps things moving. It's also a biofilm buster too. So it actually helps the antibiotics work better. There were studies using silver and ginger, and they found that when they used the silver and ginger, the antibiotics actually worked better. So I tell patients, if you need to use an antibiotic, use the ginger and silver with it. And then you can even add in the probiotics to prevent any rebound overgrowth. That way you get the best of both worlds.
Nice. That is awesome. And then I guess the last step in our toolbox, we're talking protocol, would be another test, because once you go through you talk us through the process, removing bad foods, replacing enzymes, repairing the gut, infections, re-inoculating probiotics, then the last step in this whole protocol is the test itself. Retest and make sure all the stuff we implemented was successful.
100%. Yeah. So if we have a specific infection we're going after, we definitely want to put it in our crosshairs. We want to aim at it, and then we want to go look through that scope again and make sure we actually hit it right. That's kind of where that lab test, retest would come in. Sometimes if it's just insignificant, smaller amounts of yeast or smaller amounts of bacteria, and there's not any major stuff, there's no H. pylori, there's no like significant bacterial overgrowth, there's significant fungal overgrowth or any parasites, then we'll just base it off of symptomatic relief.
Yep.
If there's anything significant, then I want to make sure that we retest for sure.
Yeah, that's a great point. People ask that all the time. Should I retest? Do I really need to retest? Maybe, but if you feel amazing, maybe we can assume and your hair's better and your skin's better and your nails are better. Like for me, I noticed when I thought my infections were gone because my weight loss stopped, like my weight stabilized. But I still did the retest because I had the Giardia, Crypto, H. pylori, Pseudomonas, Candida. I had all of it. That was just too much for me to not spend the money on the
Yeah,
retest.
I wouldn't give you the choice for those kind of infections, but let's say you had just a little bit of like yeast or you had just a little bit of Citrobacter. It wasn't off the charts and you didn't have really awful symptoms. And I'd probably say, hey, if you're feeling an improvement, that's good. That's
Yeah.
good. I would say, let's just keep you in the loop to retest once a year.
So people say, well, how would I know if I'm feeling good, Dr. J? That would be things like what? If your brain's working,
Yes.
your
Every time I chat with the patient, we always go over wins, challenges, and corrections, diet, lifestyle review, supplement review. So, of course, wins and challenges, what's moving in the right direction at each appointment and what's moving in the wrong direction. And of course, we have our baseline audit in the beginning. Patient comes in day one, new patient exam. I got bloating, I got gas, I have diarrhea. We follow up. We make diet changes, lifestyle changes, supplement changes. How much better? What are our wins? Oh, well, bloating's down 80%, diarrhea is down 90%, and we continue to follow that all the way down. So each time we chat, we're always checking in. We're keeping our pulse on everything. I want to know exactly where we're at, so to speak.
Yep, well said. So if those symptoms are still there, maybe the hair's better, but you still got the gas bloating. Well, could still be some yeast or bacteria going on. Is that safe to say?
Yeah, and if we're running, let's say we're running like our GI map or our 401H and it's looking relatively clean, then the next place we're going to go to is a breath test. We're going to go to a breath test next because then there may be some bacteria on there we not necessarily are picking up. And the breath test is kind of more of a broad general spectrum because it's looking more at the gases that bacteria is producing. So not necessarily the bacteria, but it just tells us that there are bacteria there producing gases, if you will.
How about the
Like
organic
analogy
acid?
is this, right? Analogy is this. You're on top of the water. Is someone under the water swimming? Well, how do you know if you can't see them? Well, you look for bubbles coming up, right? So think of the gas that comes back on the breath test as like looking for bubbles on the surface, trying to see if someone's in the water.
So let me ask you this too. What if someone's like, I don't want to do SIBO testing? What about just coming in and giving some broad spectrum antimicrobial support? Maybe we throw in some of the silver or some of the garlic.
Yeah, it depends. I mean, typically when I'm recommending SIBO testing, people are having more severe issues and the issues have been more chronic and they're just more motivated to get answers. So it just depends, right? The more intense the symptoms are and the more chronic something's been, people typically wanted to know it's real. They want to be able to put their finger on it, so to speak. So I typically will recommend that. If they said, let's just try it first, and then I can get them who would agree that, hey, if we didn't get it to improve, then round two, I'd want to retest it. I would try to get that negotiation moving.
Yeah. So long story short, we try to base everything on labs because if you don't test, you've guessed. And we try to minimize guessing and checking because a lot of practitioners do that. And we're just not huge fans of guessing because you spend more money in the long run and the clinical outcome's not as good. Then that comes back on us. Hey, why didn't it work? Well, because we're shooting into the dark.
Well, also, like, let's say we come back, let's say we did a breath test, right? And let's say hypothetically the person was at 100 for hydrogen and 50 for methane. Okay. And then let's say we did a protocol and let's say those gases cut in half, but they were still symptomatic. Well, isn't it nice to know that you had 50% improvement on some of those gases and that you're moving in the right direction? Like imagine you had a map, right? And like Google Maps, right? And it only told you were on the right path once you got there. Well, don't you kind of want confirmation that you're moving in the right direction, right?
Yep.
That's kind of how I look at it. And the more complex and the more severe someone is, the more I like that because it gives me confidence as the doctor that we're doing the right stuff. But if the patient is doing really well and some of the things are really working well, then sometimes I'll let that one slide. But I'll let them know as a caveat that if we go in the wrong direction, that's going to be our plan B. I always want to let people know what our plan B is, just so they don't think like, oh, well, that's all I got. I'm a one-trick pony, right? So I want to let them know we got second options and third options, so to speak.
Have you used the BioHealth? I know they've got a SIBO panel they talk about a lot.
That's the panel I use. I use the 900 SIBO breath test.
Oh, okay. And that's the best one.
I like it. It's a 3-hour.
Okay.
3-hour test. And that's nice to see the 3-hour because you can get that whole window and you can see where it transitions at 2 hours to 3, which is nice.
Awesome. And then what do you want to see on there? I mean, is that kind of like an adrenal profile where you're going to have a reference range?
Mm-hmm. Yeah, we want to see methane 3 or below, and we want to see hydrogen 15 or below 15 ideally.
And so let me ask you this. If you have an overgrowth of good guys, on the GI map, sometimes we'll see the beneficial bacteria show up high. People always target these bad bacteria, but you can have too much of a good thing. If you have too many good guys, could that also show up and trigger those?
Well, if we're running an organic acid test, we would look at D-lactate being elevated. And if we saw that there, most people are going to know because they're going to feel more bloated and gassy with probiotics. They're going to be more probiotic intolerant. So we're going to know that. Right. There's going to be, we're going to have specific symptoms that we'll be able to see clinically. And then I would just be using more spore-based probiotics instead.
Okay.
That I'd probably use Saccharomyces boulardii and spore-based probiotics versus, like in my line, we'd use like the ProBioFlora, which is like the Bifidobacter, Lactobacillus. The unique thing about my line is we add the phage. So the phage does have some antibacterial effects and it comes from a non-dairy culture. So a lot of people can tolerate mine, but if you're just doing a run-of-the-mill probiotics and there's no phage and there's dairy in there potentially, then there may be a problem.
Yep. Well said. Well, I think that's it. I think we killed that one fast, but very effective. Were there any other pieces to the whole protocol talk you wanted to mention?
I think we hit it pretty good, man. I think we're really on the right track. Let me just see if we got any questions. I have kept my question window down. I apologize for ignoring everyone. Let me see. We got. Oh, I think we do got some questions. Let me see what's going on here, guys.
Walid said he hopes that we talk about Lyme disease treatment. Maybe we could do a whole podcast on that. I mean, Justin and I are continuing to learn more about the different protocols. There's many protocols for Lyme.
I think a lot of people with Lyme are overtreated, though. I think there's a sequence that you have to go and work through. Like if you have acute Lyme and you come back with a bullseye rash, or you got at a tick bite and then some symptoms follow right away, definitely go after that right away. But if it's a chronic kind of thing, you need to get everything worked through. You need to get all your hormones worked through, digestion worked through, diet and lifestyle work through all the gut stuff, work through the detox, and then get to the Lyme later. So a lot of people I think are misdiagnosed. Their immune system's so screwed up because of other things, and then they're seeing some Lyme come back because, of course, everything's going to come back. Their immune system is down, right? It's like you open your house up and you got, you come home one day and there's 10 homeless people laying in the kitchen. Of course, your house is wide open, right? So think of that as kind of like your gut when your immune system's super low.
Yep, well said. And the thing with the Lyme, antibiotics are very, very, very overused. And if you read some of the work that Stephen Buhner's put out, he's got multiple books on this subject about antibiotics. Unfortunately, in many, many cases for chronic Lyme, they just don't work. And he's seen a lot of people get sicker from the antibiotics. So herbs, luckily Lyme and these other bacteria, they are still susceptible and allowed to be killed from herbs. Antibiotics, it's not working.
And this is really important too. And this kind of dovetails with today's podcast. If we do a whole bunch of killing, where does that all go? Well, it typically will go and get dumped in via the hepatobiliary system. And then obviously some of the killing will happen in the gut. And then what if our motility is not good? What if our digestion's not good? Well, it's going to back you up even more and you're going to reabsorb more of those toxins, right? So that's why we really want to make sure things are moving, digestion's doing good, our motility is doing good, our immune system's better, and then we have things to really help with coagulation, meaning we're keeping things moving. We're not letting the things get like static and coagulated and sticky and stuck. We want to keep it flowing.
Yeah, well said. I mean, I think we maybe oversimplified the protocol talk, but part of that is just making sure that you're not constipated. I mean, pretty simple. If you create all the garbage, but you never take the trash out, that's not good. You're going to have an overflow.
Totally. So a couple other questions here. Thanks Monmon for sharing the live show on your Twitter. I really appreciate it. Question for me, how old I am? I'm almost 34.
Nice.
Almost 34. Suggestions for root canals. I would do your best to try to read Rami Nagel's book. I would do oil pulling, and I would do your best to try to avoid it. See natural doctor. If you have to get it, get a full extraction. There is new research or new therapies coming up with stem cell therapy as well. I posted a video on my YouTube or my Facebook channel about it today. Take a look at that, justinhealth.com. I should say facebook.com/Justin Health Wellness Clinic, or click on the Facebook link. I don't know what today's topic is. I came in late. Okay. Yeah. So pheochromocytoma. I think that's a tumor on the kidney that produces excess aldosterone. I'm going back to like doctorate school physiology class. I think that's the aldosterone producing tumor. So, I mean, all the stuff we would do for cancer, ketogenic diet, toxicity, coffee enemas, curcumin, all of that. I'll let you hit the rest, Evan. Go ahead.
Yeah, let's see what else we've got. Tessa wanting to know about starting iodine, what to do to get started. Dr. Karazian talks about iodine a lot in the aspect that many people are doing it, but if they have thyroid antibodies, it's making the situation worse. So my advice would be get your thyroid panel run, look for the antibodies first, because you could, if you had Hashimoto's, you could make yourself worse if you go start pumping a bunch of iodine. And Karazian's got a bunch of literature he links to about that conversation.
Keep the selenium in there, 200 to 400 micrograms. And once you're stable, if you want to play around with some iodine, 150 micrograms to start, add 1 drop or one 150 microgram dose, per week, and slowly increase it. Just make sure the B vitamins, the vitamin C, the selenium, the magnesium, and the zinc are all in with it. And also stay tuned for my thyroid reset plan book that'll be coming out in the next 6 months. I just got a draft for the first half of the book just the other day, so I'm really excited about it.
Congratulations.
Yeah, thank you.
All right, let's keep going. Home remedies for flu and what to eat every day to avoid.
See last week's podcast. We did a whole podcast on it. Also, I did a whole blog post, what to do when you get sick, part 1, part 2. Part 1's on the diet and lifestyle. Part 2 is on the supplements. So that answers your question right there.
Man, Justin is killing it today. Oh, great. Another question, is it necessary to take HPA axis support during a kill phase if you're in stage 1 or 2? I would say it depends on your constitution. I think Justin would agree. And it depends on your sleep, your stress level, how many hours are you working, how much rest are you getting, are you working or are you off from working, what's your circadian rhythm look like, are you traveling, what's going on? Like, what's in that stress bucket?
I would say yes, it's always going to be good. And then depending on how much stress would be what specific herbs we would recommend.
Oh, we take adaptogens every day, so we're going to say yes, always.
Yes, I got mine right here. So today I'm crushing the ashwagandha supreme right here. Yeah. Absolutely love it. I'm going to hit 2 right up now. I love it. It helps with my mood. It helps with sleep. It helps with energy. I find too, I can take it before bed if I get disturbed or stressed out because I don't know, I watch the news or just something happens. Like I just got some project I got to do, some deadline. Taking that really helps kind of curtail the cortisol rush at night, along with some GABA and magnesium too.
Yeah, I've been hitting the ashwagandha, the reishi, the motherwort, the ziziphus, albizia, the GABA, chewable pharma GABAs. I love them. Those are all good choices. Hello, Dr. Jane Evan. How much probiotics are appropriate for a 2-year-old after antibiotic treatment for bronchitis? If you're looking into those infant strains that we're using, some of the infant probiotics, typically, if we're talking powders, it ends up being about
1/4 teaspoon, right?
About 1/4 to 1/2 teaspoon per day.
Yep.
And, for my daughter, we're doing that currently, and she's a little less than 2 years old, but we just put it into her drinking water, and she just sips on it all day.
Yeah, and then for us, like with my son Aiden, I'm just basically dipping my finger a little bit in some, I dump some probiotics on the container, and I'll just kind of just lick my finger and I'll just touch it, and then I'll apply it to his gums, or we'll put it on my wife's breast where my child would feed from, and just apply it there, and then when he feeds, he gets the probiotics that way. So you can do either way if they're still not doing solids.
That's a good idea.
Yeah, the Infantis strain's great. That's really what you want. I think up to age 4 is a good one. Yeah, up to age 4, that's when you want to be just doing the Infantis strains.
Tessa gave us some more follow-up about the iodine question. She does not have a thyroid and has Graves' disease. Would that change your...
So Dr. Wright has a protocol for Graves where he does really a high amount of iodine to basically overload the iodine symporter system and then downregulate hormone iodine, or I should say thyroid hormone production. There's that protocol that's out there, Jonathan Wright's protocol. I personally, and again, you need to be working with a clinician with this, Graves. It's really serious. I mean, all these conditions, I don't recommend just doing Dr. Google. We're given a lot of good information, which is great, but you really want to be working with someone and applying it. But for hypothyroid Graves, we're doing L-carnitine, we're doing Melissa and lemon balm, okay, blue flag. We're also going to be doing lithium orotate, okay, and then of course an autoimmune paleo type of template. I've had multiple patients, over 2 hands full, that I have taken them out of grave-like state, so to speak.
What's the lithium doing?
Well, lithium has an effect on modulating the thyroid hormones.
Oh, wow. That's cool.
Yeah, lithium orotate. I typically there's a formula I use with a combination of Melissa or lemon balm and blue flag and a couple other herbs in there that are really helpful. The carnitine, the lithium, that's going to be great. And of course, we added some selenium too to help with the antibodies.
Nice, nice. Great follow up there. Very good. Does oil pulling really help? Yeah, it does. We've used uh, oil pulling ourselves, both of us have, but there's some cool things you can do with it too, and there's actually some testing you can do to look for all these different infections, like hidden cavitation infections. And the oil pulling, there's some cool literature on like silver and coconut and all that, helping with like oral bad guys.
Absolutely. Vitamin K2 is going to be excellent for root canal stuff. Of course, collagen, your teeth is going to be half protein as well. So good collagen peptides is going to be excellent as well.
Last question here from Rosalind. My SIBO test results are methane 60 plus, hydrogen 20. Probiotics do not agree with me.
Yeah, I imagine, Rosalind, are you also constipated too? Can you chime in there? Methane, typically people that are methane dominant or more constipated, hydrogen dominant, more diarrhea. You're still positive on the hydrogen too, so you may have you may alternate between the two. So if you can chime in there fast and let us know what your motility is like, I can answer you more specifically.
Yeah, and we've used that Atrontil formula. It's got some of the K-Bracho extract in there, which can help drop methane.
Hey, Bracho, I love that.
K-Bracho sounds like a party or something. I don't know.
I love it. It's great.
But yeah, if Rosalind doesn't get back to us, then we'll just assume that if probiotics are not agreeing and methane's that high.
So of course, if let's say she is more constipated, then we would do things like ginger and natural prokinetics to keep things moving. We use ginger tea, maybe some of the Iberogast formula to keep things moving. Another support I use called Motil Pro, which is excellent. And then we work on knocking down that bacteria. We'd probably hold off some of the probiotics if it makes it worse, but we make sure things are moving. Maybe even some a magnesium citrate to keep things moving too.
Yep, good advice. Vitamin C too. You could pump 2 to 5 grams or so of vitamin C. That should be enough to move the bowels.
Yeah, probably a little higher than that, but yeah, I mean, I think 2 may be a little light, but definitely 5 to 8, 5 to 9 will probably move it for sure.
Okay, cool. One more question here. Why can't my eyes handle bright light? It could be due to the adrenals.
Adrenals, yep, 100%.
Typically weak adrenals. So definitely get your adrenals tested and look at some of the adaptogens to help handle bright light. Like the people, especially the women who come out of the grocery store, the first thing they do is pop down those sunglasses on, and they just can't live without them. That tells me adrenal problems.
Yeah, I agree, 100%. All right, cool. I think we answered almost everything. Would spore probiotics just thrive, be enough to repopulate to the gut after a kill phase, or should you rotate other? I would rotate other strains. I'm not familiar with Just Thrive. I'm a big fan of Mega Spore Biotic. We have it on our site, justinhealth.com/shop. Under gut section, we'll put the links in the show notes. I like that one. There are a couple others that are out there that are really good. I know Primal Defense by Garden of Life is a decent one. I like the Megaspore though.
Yep.
Cool. And then it says okay. So I don't know. Yeah. So that's about the pheocytochroma. I'm not sure. That's a tumor. So you'd really want to get that resolved there with your doctor, but you'd have to go on the anti-cancer protocol for that. Hope that helps, guys. Any other questions, comments, or concerns, Evan?
I think that's it for today. If people want to reach out, schedule a consult with you, check out Justin's site, justinhealth.com. You can book a consult with him. If you'd like to book a consult with me, either of us, we're happy to help you. You can just check us out. evanbrand.com is me. And make sure you subscribe to the YouTube channel here. We're 33 plus thousand. So let's get Justin up to 50 grand, you guys, and then 100 and then 1 million. So subscribe, and share, because sharing is caring, and education is the first step to greatness. How can you approach this stuff if you have no clue? You can't. You got to learn, and then you can apply.
Absolutely. And just so everyone knows, if you're listening to us on YouTube, we have the conversation and the video kind of going back and forth so you can see our ugly mugs, but we also have the podcast link, and we are recording our podcast in super high audio quality. So if you want to upgrade the audio, feel free and subscribe to our podcast channels. Again, we'll have them in the show notes if you listen to Evan or I. So we have the upgraded audio for you, and that's only been the last month or so. So we're really trying to up our game, guys. We want to make sure you get the best information at the highest quality at your fingertips.
Yeah, so that's on iTunes. So look up Justin Marcagiani, or just type in Beyond Wellness on your iTunes or podcast app, and you can subscribe there. Cool thing I'll tell you about Justin, iTunes just released a podcast analytics, so now we can check and see, are people actually paying attention for the full episode, or has everybody stopped listening after 20 minutes? Now we can see the drop off, so it's pretty neat. And then for my show, it just type in my name, Evan Brand, and you'll find it.
Absolutely. I think if you go to evanbrand.com, there'll be a link for your podcast. If you go to justinhealth.com or beyondwellnessradio.com, there'll be a link there for the podcast. Click it. It'll bring you to the button where you can subscribe, and then we'll make sure you get updates as soon as you can. And then also, if you're listening on YouTube, smash the bell. YouTube's doing some funny things. You're not going to get the notifications if you are subscribed. So hit subscribe and then smash the bell right next to it, and that way you'll get all the notifications. And we're going to try to continue dropping lots of knowledge bombs. Let us know. Give us some comments below the channel if you're listening on YouTube about this. We want to hear some of your concerns. We're going to work on responding to them a little more. And also, we want to get more feedback on what you guys want to talk about. So let us know. We really want to engage you and bring more information. Our goal is to help, 10 million people. So, we're doing in the thousands range right now. We want to help more. So allow us to help you by figuring out what your needs are, and let us help you fulfill it. Okay.
Amen. We'll see you guys after Christmas. So I hope it's good for everyone.
Yeah. Merry Christmas to everyone. Happy holidays too. And hope you guys all have a happy, healthy new year, and check out our Hacking the Holidays podcast. Lots of good solutions there, so you guys can kick butt, stay healthy, and not get sick throughout the holidays.
Amen, brother.
Hey, Evan, great chatting with you, man. You take care, and Merry Christmas.
Take care. Merry Christmas to you.
Take care. Bye now.